Hi there. Something that we're really proud of here at National Custom Compounding is the rigor and seriousness of what we do for patients like yourselves and also your prescribers and healthcare professionals. So the question today is, what safety checks happen before a compounded medication leaves the lab? Now, by lab, we talk about the whole business. We are regulated as a compounding pharmacy in Australia, so the regulations are quite tough, and we do have to operate at a high standard to make sure the medicine we make for yourself is exactly what it should be. So there's some really key steps that I'll just talk you through now. The first step is actually before anything happens, and we would call that a prescription review or a risk assessment. This is done by our team of pharmacy assistants and pharmacists, and basically before anything happens to the order, we make sure that it's well suited for the patient, it's safe for the patient, that the patient doesn't have any contraindicated medicines, and also to see whether the patient understands that their product is being compounded and what that involves. So it's quite a big process, and it does take a little bit of time. The step after that is more of a lab ingredient process. So we have a verification process that makes sure that all of our ingredients from all of our suppliers are of the highest quality and all come from verified suppliers. So that makes sure that all of the suppliers are acting in a way that is approved and verified in Australia to ensure the ingredients themselves are trusted. The next stage, once a product is risk assessed and checked by pharmacists, it then moves into the lab to be made. And there's a whole lot of technology in our compounding labs that review the order, that review the products, that check the right products are used, check the right weights are made, and ultimately, once the product is finished, all of the photo verification that the lab technicians undergo make sure that the product looks like the pharmacist expects and all of the measurements are made accurately. So this ensures that the production stage is done again to the highest standard. Once that's finished, it then goes into a secondary pharmacist check, which means that everything that's made is checked a second time by another pharmacist. Again, this is just to ensure that everything is created to the stage that we require. Everything is made to the highest standard and is exactly what the patient expects. And once that final pharmacist check is made, we have some automated systems in our process that also check that all the software was followed in a correct way by all of the people to ensure that really the overall quality assurance and quality control process was valid and validated by the time that it was at the end. This leads to the documentation that we do. So we do a range of documents, including formulations, standard operating procedures, processes that must also be attached to that particular order. So if you can imagine, we've got hundreds of individual products being made every day, and all of those products must go through a really rigorous safety and auditing process. So there's lots of process, there's lots of documentation. Ultimately, though, that's very deliberate because we want to make sure that the patient receiving our product is getting exactly what they're after and is exactly as their prescriber intended. So look, hopefully that gives you a bit of insight into our complex process. Hopefully you can trust what we do and how we do it. And if you've got any questions, feel free to reach out. We'll see you soon.